This is Therapy Ed Chapter 2, Effective Examination Preparation. When starting to prepare for the exam, start with a positive outlook. Fear, doubts, and negative attitudes must be replaced with a positive outlook. Remember that to be eligible for the NBCOT exam, we had to pass all the classes and challenging fieldwork, thus we do possess the skills needed. Staying motivated is also important. Write down reasons why you want to be an occupational therapist and read them when you feel unmotivated while preparing for the exam. When structuring a review for the NBCOT exam, know that the clinical reasoning skills are vital because it's about application of knowledge. Review your academic history to help clarify strengths and weaknesses. Next, develop an individualized study plan. Organize content areas into a review and must-study areas. If you're having trouble with a particular content area, on the Therapy Ed website, there is a Create Your Own Exam feature that you can create an individualized exam that focuses on any particular area. Allocate your time wisely. First, master a weak content area and then review a content area of strength. Doing this helps prevent study fatigue and burnout. Be realistic when planning the amount of time needed. Don't give yourself too much time or too little time. Next, create a routine. Establish a study schedule and stick to it. Identify the study habits that have worked for you in the past and use them now. Do not take the online practice exam until after you have mastered the must-study list you created earlier. Completing before you finish studying will only reinforce that you have gaps in your knowledge. Completing a practice test after studying will help you target any areas that you need to spend more time studying. Revise the study plan based on the practice exam results and then take another practice exam. Repeat this process for all the practice exams. Be sure to take the practice exams in one continuous 4-hour period to increase comfort, including a 10 to 15-minute break to mimic the actual test-taking experience. Critical reasoning is a decision-making process which utilizes a person's knowledge, skills, experience, and logic to draw conclusions about everyday situations. Knowledge of facts and critical reasoning are a vital foundation for NBCOT exam. This table applies clinical reasoning to NBCOT exam questions. The first type of reasoning they talk about is procedural reasoning, which guides the therapist thinking about a patient physical performance problem. It requires gathering data and understanding it to identify problems, set goals, plan intervention, and treatment. These are the questions that will ask about diagnosis, symptoms, prognosis, or treatment protocols. Interactive reasoning understands clients as people experiencing illnesses and about using therapeutic use of self. These will be the NBCOT questions that will ask about rapport, family involvement, or therapeutic use of self. Pragmatic reasoning considers the everyday realities of providing occupational therapy in context. Examples of these types of questions are client factors, reimbursement issues, physical space, and supplies. Conditional reasoning is a combination of procedural, interactive, and pragmatic reasoning. Conditional reasoning questions will ask about the individual's unique roles, impact of illness on the person's function, and where will the person live after discharge. You can reference Table 2-5 to give you tips on how to master clinical reasoning questions by self-assessing your weak content areas. These are the 5 sub-skills of critical reasoning. Inductive reasoning starts with reasoning in a specific situation and leads to drawing conclusions about a generalized situation. It is used in diagnostic thinking to form assumptions about what to expect from a diagnosis as it evolves and changes over time. Deductive reasoning is a process of reasoning in which conclusions are drawn based on facts, laws, rules, or accepted principles. It is the reverse thinking process of inductive reasoning. It starts with information about larger theories and applies this knowledge to a specific situation. Analytical reasoning is the process of inferring the meaning of information, determining relationships, and then making assumptions about that information. Information presented in the forms of graphs, charts, tables, and pictures. Inferential reasoning is the process of drawing conclusions based on facts and evidence rather than direct observation. It is used in practice when a therapist infers the symptoms to expect based on a diagnosis or the progression of a disease. It is also utilized when the therapist has to decide on a best course of action. Evaluative reasoning. This helps guide thinking about a correct course of action. It is often used in OT practice when difficult decisions must be made in areas that have no clear-cut answers. Situation might require the therapist to evaluate the situation, weigh the information presented, and determine a correct course of action, given their knowledge and experience.